I'm grateful for the opportunity today to testify about the plight of our nation's children. I come before you today not as a doctor or a lawyer, but as a child advocate. I grew up in what was at the time one of the poorest cities in the country, El Paso, Texas. My parents were raised in the Texas Panhandle in difficult circumstances and sought out education in pursuit of a better life. They both became teachers, and I would hear them talk about the many factors of importance to the education of children, including their health, their development, their economic status, nutrition, housing, and safety. When I was a child growing up in El Paso many moons ago, 40% of the children in our community did not have health insurance. I had a classmate who died because he did not have access to health care. It felt then, and it still feels so wrong. Even today, Texas leads the nation in the percentage of uninsured children. We must do better. In my capacity, I first focused on children, which Colin and Alma Powell initially founded as part of America's Promise. Our operating premise has been that children's issues are and should remain bipartisan, and that we must listen to and lift up the voices of children in these discussions. I would assert that almost every issue is either a children's issue or has a children's angle that is often ignored or missed. I would like to refer you to some examples of our work. It's things that we've sent to your offices, but one is our children's agenda, and another is our children's budget. I include those in my testimony as well, in my written testimony. Unfortunately, on many measures of child well-being, children are not faring well. The list of issues threatening today's children is staggering and growing. Infant mortality is on the rise. Child mortality is on the rise. Child poverty is rising. Uninsured rates for children are growing. The children's mental health crisis is soaring. Measles and other preventable diseases, including pertussis, are back. Homelessness is up. Hunger is surging. Child care is in crisis. Child abuse deaths are increasing. These are not niche or isolated problems. They are the foundational issues of childhood and human development going unmet, and worse, symptoms of how we are neglecting and failing our youngest children.